And again, welcome everybody to today's informational webinar on the Robert Wood Johnson Foundation Systems for Action Call for Proposals. Our participant numbers are still climbing, so I'm going to pause for another minute or so just to make sure we get everybody into the webinar before the real information starts to be shared today. So just bear with us for another minute or so while we're getting everybody into the webinar room. Okay, well, again, thank you so much for joining us for today's webinar. We will be discussing the 2025 Robert Wood Johnson Foundation Systems for Action Research Program Call for Proposals for Community-Led Systems Research to Address Systematic Racism. My name is Glenn Mays. I'm a professor at the University of Colorado School of Public Health, and I have the pleasure of directing the National Program Office for the Systems for Action Research Program. Um, so, our agenda for today, I'll give a brief overview of the Systems for Action Research Program, what it's about, what kind of research that we support and produce through this program. Then I'll be spending most of our time today discussing the 2025 call for proposals that was released last week, and what the kind of research that we are looking to identify and support through this most recent call for proposals. We'll then third talk about some of just the nuts and bolts of how to apply, how to submit an application for this call for proposals. And then we will leave time at the end of our hour for questions from you all who are participating in this webinar. And I'll tell you in just a moment how to submit your questions. A few housekeeping details. First of all, we are recording today's session. We've got a large number of participants. So you all who are joining us, participants, are unfortunately are joining in a muted mode, so you're not able to actually talk with us during the webinar, and that's just because there's so many people with us today. But you can absolutely submit questions, and we'll answer as many of these questions as we can during today's session. If we don't get to your question during this hour, we'll make sure to respond to your question after the webinar is over, via email. There will be a link to today's slides, and today's recording will be sent out to everybody who registered for today's webinar. We'll also post the slides and recording on our website, which you see listed in the link here on this slide, systemsforaction.org. Again, please submit your questions at any time during today's webinar by clicking on the Q&A box that you should see down at the lower on the toolbox to the lower portion of your screen. If you're like me and you don't see a Q&A icon, you might see a more icon with ... Click on that more, and you'll see a menu option for Q&A. Click on that Q&A box, type in your question, and again, we'll get to as many of those questions as we can during the latter half of today's webinar. Again, if we don't get to your question today, we will make sure to address it via email. We've got your email address if you register for today's webinar. So, and then you can always email us with additional questions, and I'll tell you more about how to contact us a little bit later in today's webinar. So I want to just introduce you to some key people who are involved in the Systems for Action Research Program. First and foremost, Dr. Isabel Cuervo, who is our program officer at the Robert Wood Johnson Foundation. She is with us today as well, and will help us to navigate any questions that come up. We also, as I mentioned, I am part of a team in the National Program Office for the Systems for Action Research Program. That program office, or NPO, is based at the University of Colorado here in the Colorado School of Public Health. And you can see my colleagues listed on this screen include Carrington Lott, who's our deputy director, and she's with us today. Sadina Belmashkin, who is our program manager and communications manager, also with us today. And you can see some of our other key staff, including Julie Rezola, Phoebe Downer, and Nate Dimke. I think all of those folks are with us today, as well as Lene Bounds. So these are some of the faces and names that you'll see as you interact with our program, and particularly as you if you work to prepare an application and submit to today's call, the call for proposal we're talking about today. A little bit more about the Systems for Action program. If you're new to our program, we are a signature research program of the Robert Wood Johnson Foundation, launched nearly 10 years ago with a mission of conducting research to create new knowledge about how to align medical, social, and public health systems in ways that can improve health and especially advance the cause of health equity. So we support rigorous research to test new ways of helping medical systems, public health systems, and social service systems work together, align their services, supports, research, resources, and missions in ways that can especially improve health and well-being for populations that experience health disparities and inequities. As a program, we have been funding research studies all around the country over these last 10 years, testing a whole variety of ways of helping these different multi-sector systems work together, align their activities. Testing things like novel governance and decision-making structures, testing strategies like novel financing and payment mechanisms to facilitate sharing of resources across medical, social, and public health systems. Testing novel workforce and staff and shared staffing mechanisms that can cut across these different systems. You can access more information about the kinds of studies we funded previously on our website, again shown here. We also have a research agenda that can describe in more detail the kinds of issues, the kinds of knowledge that we're trying to create about how to make our systems work better together and advance the goal of health equity. In recent years, our Systems for Action research program has focused more specifically on the problem of systemic and structural racism, and in particular, testing strategies to help dismantle and disrupt forms of systemic racism that tend to get embedded within medical, social, and public health systems. That has been our major focus in the recent years of the Systems for Action research program and continues to be our primary focus in the 2025 call for proposals. That brings me to the 2025 call for proposals. Some highlights about the kinds of research, the kinds of new knowledge that we're trying to generate through this call. In this call, we are looking to identify and support community-led studies that will test new system alignment interventions that improve health and well-being, specifically for populations that experience systemic racism. So we are continuing our focus on looking for solutions to systemic racism, solutions that involve aligning medical, social, and public health systems. In the title of the CFP, we are very prominently highlighting we are looking for community-led research. And so in this call, applications submitted for this call should be led by a community-based organization. And we describe our definition of the community-based organization in the CFP. This includes a nonprofit, tax-exempt 501c3 nonprofit organizations. It includes government agencies, units of state or local governments, and it includes tribal organizations all these organizations that serve communities that are affected by systemic racism. So we're looking for research proposals that are led by a community-based organization meeting this definition, as opposed to what is more often the norm, which is research proposals tend to be led by research organizations, universities, academic organizations, or research institutes. And we recognize that the research community is very important to engage in this kind of enterprise, but we are looking in this particular call for proposals that are led not by a research organization, but by a community-based organization, nonprofit, government agency, or tribal organization. Um, and most likely, a community-based organization is working in partnership with a research organization that can help to design and carry out the research that's proposed in the application. As with all of the studies that we have funded in the S4A program over time, the system alignment intervention that you're proposing to test through your project must engage all three types of systems: medical systems, public health systems, and social service systems. The S4A program uses a broad and inclusive definition of each of those types of systems. Who recognize those systems are comprised of delivery systems, organizations that are involved in delivering those services, as well as financing systems that are systems that are designed to get the resources to those organizations for service delivery. And so those kinds of systems remain a focal point of our S4A program. But again, we are looking for proposals that propose to test a novel system alignment intervention that engages all three of those types of systems in collaborative activities to address systemic racism. Another key word to note in the title of the CFP and throughout our description of the CFP is the word pilot study. This particular call for proposals is designed to support pilot studies, smaller scale, early stage research to test the feasibility and the acceptability of a new system alignment intervention, and to test the potential of that intervention to improve health and well-being for populations that experience systemic racism. So we are looking to fund pilot studies, early stage, small scale tests of feasibility and acceptability. And pilot studies that hopefully, if successful, they can lay the foundation for future larger scale studies that would test the effectiveness and the impact of the system alignment intervention that's being proposed. Second to last bullet point here, very, very important. We are looking to support studies that engage people directly who have lived experience with systemic racism, engaging those communities and people directly in developing and testing the proposed system alignment intervention to be a potential solution to that systemic racism. So engaging people with lived experience, very, very important component of the kind of research that we're looking to fund in this study. And then finally, last bullet point here, while the applicant organization needs to be a community-based organization that serves communities affected by systemic racism, we expect that in many cases, that community-based organization will want to partner with an experienced research partner or experienced research team who can help to carry out the research aspects of the pilot test activities. So these are some of the key components of the kinds of studies that we hope to identify and support through this 2025 call for proposals. A little bit more details. The awards that will be provided through the CFP, up to $200,000 in funding will be available per project or per study. Funding that it should be used to pilot test the proposed system alignment intervention. And these funds can be used over a period of up to 12 months to conduct the small scale pilot test study. The Robert Wood Johnson Foundation anticipates funding up to 5 studies, pilot studies through this CFP. A few other details we've noted in the CFP, recognizing again, stressing that the applicant organization needs to be a community-based organization. That organization can allocate up to 50% of the project budget to a subcontract with their research partner, again, to carry out support some of the research aspects of the pilot test program. And again, major goal of this funding opportunity is to generate preliminary pilot test evidence that will be necessary and will lay the foundation for the project team to pursue future funding for larger scale research that can test the effectiveness and the impact of the proposed system alignment intervention in dismantling or disrupting the identified forms of systemic racism. I do also want to know, and we're very clear in the CFP, that this CFP will be the final funding opportunity released through the Systems for Action research program. So while we anticipate these pilot studies will be designed to lead to future funding, there will not be future funding made available through the Systems for Action research program. Since the SRA program will be sunsetting at the end of the 2026 calendar year. So, um, but the SRA program will work closely with the grantees of this CFP to help identify and make progress towards securing future funding and support from other sources, including other sources at the foundation as well as other health related funders around the country. So a few more details of the award. I do want to call attention to the fact that in the CFP document, and again, I'll make sure that you all know where to find that CFP document and stress that it's important to read that full CFP document for all the details of this funding opportunity. But in that CFP document, there are three special topics of interest that are described that are topics of special interest to the Systems for Action program. Um, and so we're especially interested in seeing and receiving applications that address one or more of these three special topics of interest. However, if you have a study idea that is on a topic that is not in these three areas, but is on another related topic related to system alignment and systemic racism, you may feel free to submit an application for some other topic. So these three special topics of interest are not the exclusive focus areas of the CFP, but they are important areas of emphasis, and so we want to make sure that our potential applicants are aware of these topics of interest. Topic number one, described on this slide, we're interested in studies that are testing system alignment interventions that are designed to address resource inequities across systems. Um, so, for example, strategies that would help to allocate and share resources more equitably across medical and social and public health systems in order to provide better support for collaborative solutions to address systemic racism. So, looking at new ways of allocating and sharing resources across medical, social, and public health service providers would be an example of studies that would fit under this topic. Also, strategies that help minority communities and minority serving institutions secure equitable funding, staffing, and other resources needed to meet the needs of communities that experience systemic racism. So, studies that are in that area would be very responsive to this topic. We're interested in studies that are proposing and testing new financing mechanisms, new payment models, new staffing models, or other resource sharing models that, again, can help medical, social, public health systems work together to address forms of systemic racism. Some of the topics that kind of fit under this topic number one, we might consider to be solutions to what are known as wrong pocket problems in the health policy world. Wrong pocket problems arise when the costs of implementing a solution and the benefits of that solution are not distributed equitably among the medical and social and public health system partners that are trying to work together to implement interventions. So interventions that are designed to solve those kind of wrong pocket problems when one partner has to bear more of the costs and another partner gets to reap more of the benefits of collaboration. That would be another example of a kind of intervention that would be relevant for testing under this topic number one. A second topic of interest described in the CFP, we're interested in studies that are testing ways of strengthening the voice and the authority of marginalized and racialized communities. So testing any type of intervention that could help to give marginalized communities greater voice, greater influence, greater decision-making authority within medical, social, and public health systems, greater voice in shaping solutions to systemic racism that are supported by this kind of systems. Any types of system alignment interventions that would fall into that category of giving marginalized, racialized communities greater voice and authority within these systems would be of interest for under this call. This could include novel governance models and structures, ways of putting representatives from marginalized communities onto governance and decision-making boards of collaboratives that involve medical, social, and public health systems. Looking at other forms of decision making, like participatory budgeting models that include the voices of marginalized communities, novel approaches to public reporting and disclosure of data and information in ways that can empower communities and community advocates and organizers to have greater influence and leverage over health and social systems. All of these kind of strategies would be responsive to our interest for testing novel solutions for strengthening voice and authority of marginalized communities. Again, engaging people with lived experience related to systemic racism, very, very important for our overall program, but especially relevant for this topic area number two. And within this topic, we're also very interested in ways of incorporating indigenous governance models, indigenous decision-making strategies, and other kinds of community-led decision-making strategies. Again, that can serve to strengthen the voice of marginalized and racialized communities. So that's topic number two. Our third special topic of interest involves testing strategies that support equitable use of decision support tools within medical, social, and public health systems. So under this special topic area, we're interested in studies that would propose to test, again, new decision support tools or new technologies or new policies and practices that are designed to help decision makers within medical, social, and public health systems identify forms of systemic racism that are operating within their systems and to help those stakeholders work together to dismantle and disrupt those forms of racism. So any kinds of technologies, data systems, decision support tools that would help to identify and flag forms of systemic racism within systems. Those would be appropriate under this topic area. This could include novel data systems and novel algorithms, even the use of artificial intelligence or machine learning types of tools that are designed to identify and flag possible instances of systemic racism, unjust racial patterning, for example, within medical and social and public health systems. Also of interest on this topic area would be more generally, policies and practices that are designed to reduce the risk of implicit bias and discrimination when personnel within health and social systems are making decisions that potentially could be vulnerable to forms of bias and unjust decision making. So that would be our special topic number three. Again, if you've got an idea that doesn't necessarily fit within one of these three areas, but does fit within the larger scope of this call in terms of a system alignment solution that is designed to address forms of systemic racism, you are free, and please do submit an application, even though it may not fit within one of these three special topics of interest. Okay. Let me talk a little bit more detail about characteristics of successful applications submitted to the S4A program. I'm going to be starting to repeat myself a little bit, but hopefully that will just give emphasis to some of the kinds of qualities that we're looking for. Number one, we're looking for proposals that propose a system alignment solution that engages all three of those sectors or systems that are of interest in our program: medical care, public health, and social service systems. These are defined broadly. You can find more information about how we define each of the three types of systems in the CFP document, and also on the FAQ page of our website at systemsforaction.org. We're also looking for applications that describe a clear and convincing logic model for their system alignment intervention that describes how that intervention, if it's successful, would actually help to address health equity problems and dismantle or disrupt forms of systemic racism and injustice. So we're looking for a logic model for how that intervention you're proposing, if it works as intended, would be effective in dismantling or disrupting forms of systemic racism. This is a research program, so we're looking also for rigorous and appropriate and relevant scientific methods to be used for pilot testing the proposed system element intervention on a small scale and evaluating issues of acceptability, feasibility, and potential for impact. So we're looking at the scientific merit of the approach that's proposed as well. We also we want to see a clear description of the lead CBO applicant organization and the kinds of communities that it serves, and also how it will work. It proposes to work in partnership with an experienced research team to design and carry out the pilot test research activities. We're looking for proposals that demonstrate a commitment to prioritizing community-initiated, community-led, and community-engaged study approaches, including strategies for incorporating the lived experience of people that have experienced systemic racism. Um, this is a four-action program. We're designed to produce knowledge that can be rapidly put into action to solve problems within communities. So we want to see applications that describe a strong strategy for disseminating research results and for helping relevant audiences and users of that research to actually access and use the findings from the study using principles of designing for dissemination. And then finally, very important, especially for this CFP, since we're funding pilot test studies that are designed to lay a foundation for future larger scale research, we want to see a clear plan laid out in your proposal for how the pilot test results will be used to pursue subsequent future research opportunities to test the system alignment intervention on a larger scale and ultimately to examine its effectiveness and its impact on systemic racism. Okay, I know I've been talking a lot. Just a few more resources I want to highlight. If you're considering this opportunity, submitting an application, here on this website are links to some very important additional information and resources that you'll want to examine in crafting your application. The first is a long HTML link. That's a link to the location on the Robert Johnson Foundation website. That is the landing page for this CFP. And you'll find lots of other resources about this call for proposals on that landing page. So make sure you access that landing page and review the resources on that web page. On that web page is a copy of the full CFP funding opportunity brochure. That's the second link that you see on this page. It's 18 pages. I know there's a lot of material there, but we really do encourage you to download that, save that CFP document, and review it carefully because it has much more detailed information about the kind of research we are looking to fund through the CFP, and what information you want to make sure to include in your proposal and your budget, those kinds of things. Third, I mentioned already, we have a frequently asked questions or an FAQ page on the website of the Systems for Action program. It's that third link at the third bullet you see there. Make sure to review the FAQs. This is a living document, so we continually add new information as we get new questions. We post new questions and answers on that FAQ page. So as you're developing an application over the next couple of months, please make sure to check back that on that FAQ page regularly for more information. Fourth bullet point, there are templates that you should use in writing your proposal narrative and putting together your budget. Two key pieces of the application you will submit. Make sure to download and to use those two templates, the proposal narrative template and the budget template. These templates have much more detailed information and guidance about what to include in your proposal narrative and what to include in your budget. So really important to download those two templates and to use them when you write your proposal narrative and then when you put together your proposal budget. A few other helpful resources shown at the bottom of the slide. One is a link to our research agenda on the S4A website. And the last resource I can't see because my navigation panel is blocking. Yeah, it's a link on our website that shows you descriptions of the research studies that have been funded through previous calls for proposals of the program. We funded more than 45 studies over the history of this program. And so if you want some examples of other studies, examples of other system alignment interventions that have been proposed and studied, you might be interested in browsing that inventory of our previously funded research studies. You can also find links to research publications and other products and findings that have come out of the studies that have been funded in the past. All right. A couple other resources to keep in mind. In addition to this informational webinar, we will be hosting weekly office hour sessions every week from now to the proposal application deadline of June 4th. So for the next 2.5, 3 months, 3.5 months, every week we will have an office hour session where you hosted on the web like this one via Zoom. You can drop in and ask questions of us, get clarification about language or guidance that you read in the CFP or other resources. So we encourage you to make use of our office hour session. Drop in as many times as you like as you're working with your partners to develop your application. So please take advantage of that. More information on the schedule and how to register for those office hour sessions are shown at the link at the top of this slide on our System for Action website. All you need to do is register, and you can pop in any and every week that you want to ask your questions and seek advice and guidance. Additionally, another really important and valuable component of the Systems for Action program is our System Alignment Innovation Hub. This is a feature that started about a year ago that is specifically designed to help community-based organizations engage in the research that is supported through the Systems for Action research program. So our partners who operate the System Alignment Innovation Hub offer a whole host of technical assistance and support services specifically geared for community-based organizations to help them develop research ideas, to develop applications and proposals for research funding, and to engage in productive research collaborations with research partners. So we encourage those of you who work within a community-based organization, not a university, not a research institution, but a community-based organization, to take advantage of the resources and supports that are available through our System Alignment Innovation Hub. The link to the Innovation Hub is shown on the middle of the slide. That hub is operated by our friends at the Technical Assistance Collaborative, or TAC. Great set of resources, so I encourage you to take advantage of that. We also have the email address if you'd like to email more information to the System Alignment Innovation Hub. That email address, saih@tacinc.org, is how you can contact our System Alignment Innovation Hub. Again, we encourage community-based organizations to take advantage of those resources as you're developing ideas and hopefully moving toward developing an application for the CFP. Just a few more details about the mechanics of how to submit a proposal. First of all, again, please read that full 18-page funding opportunity brochure that's available on the RJF website. It looks like this, the first page of it. And so really good to read that. A lot more information about this call available in that document. Especially important in that document that lays out the 6 selection criteria that will be used to select applications that will receive funding through a CFP. So obviously you want to know what those selection criteria are and have those clearly in mind as you're developing your application. So those are described in detail on page 11 and 12 of the CFP. As I mentioned, we have a proposal narrative template to help you write your proposal narrative, your 10-page proposal narrative. It has a lot more detailed guidance about what to include in your proposal, how to organize that proposal, what headings and subheadings to use, even page length recommendations of how many pages to devote to each section of your proposal narrative. Really important to download and use that proposal narrative as you start to write your application. This is an example of what that proposal narrative looks like. It kind of tells you, again, major headings, subheadings to use, what content to include under each heading, really specific guidance. So that should be really helpful to you in writing up your 10-page proposal narrative. The CFP landing page also and the document clearly describes the organizations that are eligible to apply and serve as the applicant organization under the CFP. Organizations who are eligible include nonprofit organizations that are 501c3 charitable organizations, tax-exempt charitable organizations, as well as units of local and state government agencies, as well as tribal organizations. These three types of organizations are eligible to serve as applicant organizations under the CFP. Applicant organizations also must be based in the U.S. or one of the U.S. territories. Um, if it's necessary, an applicant organization may decide to utilize the services of a fiscal sponsor or a fiscal intermediary to support the administrative and grants management activities of the application. So that um, is allowable under the CFP if a community-based organization wants to use a fiscal sponsor. That fiscal sponsor can be any organization that has the capabilities to provide financial management and grants management support. And the research partner is also allowed to serve as a fiscal sponsor if that's appropriate in your circumstance. So dates, very, very important. When are these applications due, and how will this CFP process play out? Well, the CFP was published last week on January 15th. Um, the applications will be due on or before June 4th of this year. And, they are due at June 4th by 3 p.m. Eastern Time. Applications must be submitted to the foundation through the online RWJF application system on or before 3 p.m. Eastern Time on June 4th. So that's the major date to remember. Um, Unfortunately, the foundation is not able to consider submissions that are submitted late, submitted after that time and date for any reason. So please keep that in mind. Start your applications early. Start the process of uploading your application materials as early as you can. Do not wait for that last day because things can happen on the web and with computers. Um, Again, we're going to be holding weekly office hour sessions from now through that June 4th period. And so you do need to register for those sessions on our website, but please make sure to take advantage of that. Um, After the June 4th application deadline, applications will go into our review process. The foundation expects to notify applicants of funding decisions on or about August 22nd. At the conclusion of the application review process. And then funded applications should have their grants start uh, on August 1st, 2025. And that's subject to change if there are some minor modifications in the timeline. So, but these are the major dates to remember, especially that deadline for application submission, June 4th at 3 p.m. Eastern time. Okay. So that is all the material I wanted to cover. We do have time, the remainder of our time together to examine questions. And I see we do have a number of questions that have been submitted. Um, I'm going to go through these with the help of my colleague Carrington Lott, our Deputy Director of our S4A program. So Carrington, feel free to jump in as well as others on our team, including Dr. Cuervo, our program officer. Um, Question about are international students in the USA eligible to apply? Well, one thing to remember with the foundation is that individuals are not are not applicants to this organization. Your only organizations can apply for funding from the Robert Wood Johnson Foundation. So if you work for an organization that is based in the US or one of its territories, and you've got the authority to submit a grant application on behalf of that organization, then you would be eligible. Your organization would be eligible to apply. So individuals are not the recipients of a grants from the foundation, but the foundation makes grants to organizations. And for this CFP, the eligible organizations need to be a nonprofit agency, government agency, or a tribal organization that is based in the US or one of its territories. What are the acceptance rates for this funding? Well, it's hard to know for this funding because this is a brand new funding. This funding opportunity is a little bit different from the funding opportunities that we've offered in the past. I would say if you look over the 10-year history of our S4A program, we have tended to fund the proportion of applications that are funded by our program has varied somewhere between the 10, I'd say 10% to 20%, just depending on the nature of the call. Some of our calls have been very broad and wide open, and so we tend to receive more applications under those kind of calls. Other years we've had more narrow calls, and I'd say this year, the focus of this call is more narrowly focused. We're focusing on pilot studies. We're focusing on applications from community-based organizations. We're focusing only on studies that focus on solutions to systemic racism. So this is a more narrowly targeted CFP. But I would expect, the success rates, proportions of applications that are funded, generally for our program fall somewhere between 10 and 20%. Um, Question about, is it possible to use a grant award to fund data collection with CBOs to better understand how training can support the community health worker model that's used in your organization? I would say potentially, if you have a community health worker model that fits the definition of a novel system alignment intervention described in the CFP. So you'd want to think through kind of the extent to which your community health model fits our description of a novel system alignment intervention. An intervention that engages medical, social, and public health systems in collaborative strategies to address systemic racism. If that's the nature of your community health worker model, then I would say, yeah, it sounds like it would be potentially a good fit with the kind of novel system alignment interventions that we're looking to test through this call. Okay. Question about the impact of this opportunity, considering new leadership of the country and efforts to de-emphasize equity-based programs. Well, I think, yes, we have a new presidential administration at the federal level of our government. We also know that we operate in a federal system of government with not just the federal government being setting the agenda, but also important, very powerful roles played by state and local governments and other decision makers in our health and social service system. So I would say we continue to need new opportunities for testing and generating new evidence and new knowledge about how to dismantle and disrupt forms of systemic racism. So I think I may be a little biased in my view, giving my role in this interaction program, but I think we need this kind of evidence now more than ever. And so I think we encourage you, if you've got an idea for a potential solution that can dismantle systemic racism, let's test it now. And we're going to need strong evidence to prove that these strategies can work. Um, so let us hear from you. Question: do
Oh,
not-for-profits
Glenn,
qualify as well? Oh, yes.
Isabel has her hand raised. She might have a different
Oh, thank you,
perspective.
Isabel. I'm
Right before
sorry.
Robert Johnson.
Thank you. Please do.
No problem, no problem whatsoever. I just wanted to echo Dr. May's comments. We are really, let me take this off. We are looking to support the evidence base as the community leaders and the academic partners see it, as you need it to do your work. So we just wanted to, I wanted to emphasize that commitment.
Thank you so much, Dr. Purview. And the foundation has a long history of leadership in this space under many different federal administrations. So I think there's a long record of successful solution generating at the foundation that we can build from. Moving down our list of questions, a question about our not-for-profits. Are they eligible as well? So absolutely. Tax-exempt 501c3 nonprofit organizations are absolutely eligible to serve as applicant organizations under the CFP. And yes, that would include not-for-profit hospital systems, a related question that was asked there. So hopefully that's clear, and that also should be spelled out pretty clearly in the CFP document. I'll scroll down a little bit. Is the call exclusively for research or designated at all for direct services through a CBO? So yes, importantly, this System for Action is a research program of the foundation. And so this call is specifically to fund research studies, to fund early phase pilot testing research studies to test the feasibility and acceptability of system alignment interventions. This funding is really not designed to provide funding for ongoing direct services. So that that is a good question. Um, I'm going to scroll down. Question, are applicants required to partner with a research institution, or can applicants work with internal data analytics team? Good question. So no, you are not required as an applicant organization to subcontract with a research partner. If you're an organization that has an internal research team that can support the needs of the pilot test, then that could be appropriate. We do, however, encourage applicants to consider the benefits of working with a research partner, the ability to bring in additional expertise from outside, the ability to have kind of a more neutral third party perspective on the research, particularly if the applicant organization is involved in implementing your system alignment intervention. Many times it can be helpful to have an outside organization partner to perform some of the research and evaluation activities, just to have a kind of a neutral third party viewpoint on the activities. But you are not required to partner with a research institution. I would just say there can be really compelling benefits, so we encourage you to consider the benefits of that type of approach. Would a hospital be considered a community-based organization? Yes, a public or nonprofit hospital would meet the eligibility criteria for this funding opportunity. So yes. Another question is gun violence and other systemic impediments to social determinants of health viable candidates? Potentially. I mean, certainly there are, the research on gun violence does show a connection between forms of systemic racism and that can create vulnerabilities to gun violence as well as other problems. So if you can connect your problem and your potential solution to forms of systemic racism to fit within the focus of the CFP, then that certainly would be a viable topic to address under the CFP. Question, would you describe each of those three systems since all three have to be covered? In the interest of time, I'm not going to do that here, but I am going to direct you, one, to the CFP document itself that describes those three systems. And then secondly, I'm encouraging you to read our FAQ page on our website that describes in much more detail how we define medical care systems, how we define public health systems, and how we define social service systems. We use broad, inclusive definitions of each of those three systems, but definitely encourage you to look carefully at those definitions as you're developing your application. So, Karen, I'm going to hand it over to you to take us through another batch of these questions.
All right. Thank you, Glenn. Okay, moving right along to the next question. Can CBOs that are not nonprofit I think this question is asking if a nonprofit can use a fiscal sponsor, which Dr. Mays did cover. Yes, you can use a fiscal sponsor. And we have great FAQs about that, and we have lots of information in the funding opportunity brochure that you can read through. And if you have additional questions, you can come to some of our office hours and ask us some specific questions about using a fiscal sponsor and what that process is like. Next question, will organizations that primarily serve marginalized and disabled folks, including those disproportionately affected by systemic racism, be eligible for this? Yes, we are looking for CBOs that are nonprofit organizations, government agencies, and tribal organizations. So if the organization that you were speaking about is one of these, you definitely would be eligible for this as long as you have a system alignment idea that you're looking to pilot test. Can a community-based nonprofit organization who is currently waiting for the 501c3 approval apply? This is a great question. Isabel, Do you have any information on this from Robert Wood Johnson Foundation's perspective about an organization that is waiting for approval for 501(c)(3)?
I would have to confirm that, but my suspicion is that if the approval is expected within the time that the grant would be awarded, it's probably okay, but if it is not, it's probably not. However, I can put in a question, a call to our finance department. We just wouldn't get the answer right now, but I could relay it to you, Carrington and team, and then you can potentially put that on your FAQ or relay it somehow.
That sounds
But
great.
thank
I
you
think
for the
we can,
question.
yeah, we can put that on our FAQ questions and then also include it in the follow-up document that we'll share with all of the unanswered questions that came in, because we will take time to respond to each one of those. So we will definitely make sure that everyone here in this webinar has the answer to that question. Next question, is mental health included? I'm guessing this person is asking if it's one of the three sectors that we're focusing on, or if mental health fits somewhere in there. And yes, broadly it does. I think I would need a little bit more information to speak more directly to that. And then the second part of that question is, can a portion of funds be used to pay the research team? Yes. So up to 50% of the total budget can be allocated to the research team. Next question, are academic medical centers eligible to apply? The institution is tax exempt. No, we are looking for community-based organizations, and so not eligible. Next question, can funds be used to purchase produce and healthy foods that directly relate to the research pilot study? I think this is sort of similar to the question that was asked earlier about using the funds for direct services. This is not something that this research funding opportunity is looking to support, since we are looking to fund research and not necessarily direct services. Donna Lewis asks, can you define small scale studies? So for this particular funding opportunity, we are funding 12-month pilot studies that are up to $200,000 in the award amount. If you have more specific questions about what we mean by small scale studies, please feel free to reach out. These are pilot studies that we're looking to fund. So we're really looking for teams that are assessing the acceptability and feasibility of a system alignment idea, and something that can be done in 12 months, and looking to develop a larger research question that can be studied and tested and evaluated after the pilot study is completed. Next question, does our organization need to find its research partner team, or will Systems for Action partner us with a research team to explore a system alignment intervention? Great question. So I think we have a couple of different resources that I would point you towards. The System Alignment Innovation Hub is a great team that you could reach out to. I'm not going to say that they're necessarily going to partner you with a research team, but I think they're a great resource to discuss this with. And we also have, I'm going to ask my colleague Phoebe Downer to post into the chat the applicant resources web page, which has some information about some different resources that you can use if you're looking to partner with research teams like the ACES team at Johns Hopkins, or trying to access some kind of relationship or partnership through a local CTSA, or you can come to some of our Systems for Action office hours, and perhaps a connection could come out of there if there's a community-based organization that's looking for a research partner. Okay, I think we have time for a few more questions. Does the target community need to be in the United States? This is a great question. One that we were asked last year. We have not funded through the Systems for Action program a research project outside of the United States. We're not totally opposed to it, but I think we're focused on research projects that are based in the United States, because many projects that are looking outside of the United States may not be translatable to the United States in our own systems. And so I'm not going to shoot it down, but probably not likely. Um, allowable indirect cost rate. So I'm going to put this link in the chat. It's RWJF's indirect cost rate, so everyone can see it. It's 15% for colleges and universities and 30% for nonprofit organizations. Feel free to open up that link and save it if you need it. Next question, CBOs generally do not have access to IRBs. If we need to go through the IRB of the affiliated institution of the research partner, the community-driven nature of the pilot is undermined greatly. Can RWJF establish an IRB for this initiative? That is a great question. I don't know if that's going to be something that we're going to set up through this funding opportunity, although I think this could be a conversation that we have and maybe have some great suggestions and supports there for going through the IRB approval process if you're not looking to use the research partners process. I would direct you to maybe send us a direct email and let us know exactly what's going on in your own CBO and partnership, and we can provide some more direct feedback on that. Let's see. Is there any potential for additional funding? The allocated amount seems small given the need to pilot and also publish the study. So this it is set at $200,000 for the 12 months for this pilot award. One of the TA, like technical assistance that we'll provide as a program office and a conversation that we'll have for the projects that are funded is using the findings from this to set your team up for success in developing a larger proposal to submit through RWJF or through another funding mechanism to test the system alignment initiative. Let's see, moving right along. If the applicant CBO has its own research and evaluation team, does it still need to partner with an external research team? It is not required, but we do suggest partnering with an external research team to reduce internal bias. We have some information about that in the funding opportunity and state why we think it would be important to use an external research partner. So definitely invite you to read the funding opportunity brochure. Um, think we'll have time for maybe one more question. Somebody's asking about the office hours. Can we pitch ideas and get immediate feedback? Yes. I don't think we're going to tell you exactly how to write your proposal or what to put in it, but we will provide very general feedback on some of your system alignment ideas. And if you have specific questions about submitting your proposal or have some barriers that you're facing, we're there to address those and discuss them during that time. Okay, I know we did not have time to answer all of the questions that came in, and there are some fantastic ones. We will download a report of all these questions, make sure that we answer them, and we'll include a PDF of all of the questions and answers in our follow-up email. That will also include the recording of this session and the slides that Dr. Mays covered during today's webinar. So thank you so much for joining today. Sadina did just put into the chat that we have our first office hour tomorrow. We invite you to join. If you can't join tomorrow, we do have these weekly at different times so that hopefully you can find some time that meets with your schedule best. So we're looking forward to hearing from each and every one of you. Thank you.